Okay, we are now live. It is our first Q&A of the month of October.
Hey guys, welcome back. Sorry we've been a little bit absent recently. We've been very busy. Just struggling to find time for these Q&As. We love to do them. We promise we'll try to do more often, more regularly. We're going to shoot for once a week. But anyways, glad to be here with you. Let's do some questions and answers.
Alrighty, so first question. For breast procedures, do you prefer implants or fat transfer when it comes to adding volume into the breast areas?
Well, they're both good depending on what you're trying to accomplish. So, for example, if you're trying to get more than a 1 cup size increase in your breast in one surgery, you're going to want to look at an implant. It's fairly challenging to increase your breast cup size by more than 1 cup size in one session with fat transfer. Fat transfer tends to max out about a cup size per session. Some people you can get a little bit more, but most people are right around that amount. So implants are better for more volume increases. Fat transfer has the flexibility of adding volume exactly where you need it. For example, let's say the bottom half of your breast you love, the top part of your breast is a little bit less volume than what you want. Fat transfer is perfect for that. An implant, on the other hand, would add volume to the upper part of the breast and the lower part of the breast. So that's where fat transfer works great. Of course, the other part of fat transfer that's wonderful is that it changes with you. So if you gain some weight, the fat gets bigger, and then so your breasts get bigger. If you lose a little weight, the fat gets smaller. So your breasts get a little smaller. And there's also no implant associated issues. So you don't have to get the implants removed. They don't obviously have any potential of rupturing, that kind of stuff. So fat transfer definitely has its advantages. The primary limitation is it can't really have that firm, kind of full look that an implant does. And it can't do more than about a cup size increase in one session.
Right. Ms. Connor would like to know, during a tummy tuck procedure, can you adjust where you put the belly button and the height of the belly button?
There is some variability there. A lot of it depends on how long your belly button stalk is. Because if you have a fairly short belly button stalk, we're limited on side to side and up and down positioning of that belly button stalk. If we put too much tension on the belly button stalk, trying to get it up higher or lower or side to side, then it's going to create potentially some poor scarring at that border of the belly button and the new skin. If you have a very long belly button stalk, then you can put that wherever you want. The other interesting thing is sometimes the belly button stalk is average, but the muscles are very relaxed or very separated. So as you're fixing the muscle separation, as you're tightening up the muscles, it pulls the belly button stalk in and it shortens it a little bit. But the short answer is yes, there is variability on where you can put the belly button location within a range.
Okay, Mary Anna would like to know, how long after a C-section for twins can you get a tummy tuck procedure done?
Well, it doesn't impact the tummy tuck, so you can get it at any point. I think the key is when's the optimal time to do a tummy tuck after a C-section. So after a C-section, there's going to be a little bit of swelling and some inflammation because you've basically had surgery there. So that might take a good month or two for it to really settle down. The other important part is it might take a month or two for the muscles to really tighten up and for the skin to tighten up a little bit. That's important because if the skin tightens up a little bit, then the incision for the tummy tuck is going to remove less skin, which means the incision can potentially be shorter. So I would say, well, when's the optimal time after a C-section to get a tummy tuck? And the right answer is when you're not seeing that much change in terms of improvement following your C-section and your pregnancy. I would assume it's going to be a couple months out.
How do you know if you should qualify for a tummy tuck procedure or lipo 360?
Well, liposuction removes fat. A tummy tuck will remove skin as well as fat, and of course it can also repair muscle. So if your skin's in good condition, if you're, let's say you haven't had any pregnancies, if you're fairly young, if you don't have a ton of stretch marks, if you don't have a lot of loose skin, then liposuction is perfect if you just want to contour the waist with liposuction 360. If you have any of those things, if you have multiple kids, if you have a lot of stretch marks, if you have some loose skin, if you have some overhang of your tummy area over the pubic area, a tummy tuck is going to be needed if you're really trying to correct that area to be smooth and tight and nicely contoured.
Okay, Stacy would like to know, how much do I need to weigh for a BBL procedure?
That's a great question. Well, it all depends on how tall you are and how much you want improvement in the buttock area. So it's going to be challenging for me to give you a good answer. But basically, the best area to take fat from is the areas where you gain fat first. So maybe it's the midsection, maybe it's other areas, maybe thighs or things of that nature. Well, look around primarily your waist, and if you can pinch a lot of fat, then that fat can be transferred to the buttock area. If you can't pinch that much fat, then there's not enough fat to transfer, so you might want to start the process of gaining some weight.
Okay, Yvonne would like to know, why do you include liposuction with your plus-size tummy tucks?
Trying to get the best result possible. I don't want to leave the operating room with something less than 100% of what I could possibly do in the operating room. And it cleans up the decision-making process, because if I say, well, listen, removal of the skin is a tummy tuck, but if you want liposuction, that's extra. If you want muscle repair, that's extra. If you want pubic lift, that's extra. Then some people will not understand what their tummies and their waists can look like, how good they can look, and they may opt for less procedures, and then they'll just get a more average result. And to be honestly, I prefer to get as good of a result as I possibly can with everyone.
Okay, following that question, do you do liposuction first or the tummy tuck first?
I do liposuction first, then I do the tummy tuck, and then I finish off with more liposuction at the end.
Perfect. Okay, Nancy would like to know, can a plus-size body be contoured? Like, I want a small waist.
Yeah, so let's define what that is, right? So a waist has a front and a back, technically, right? You can say, well, it has a front, back, and sides. Everything from your pubic area to your rib cage is the waist in the front. Everything from the buttock area to your bra line in the back is the waist in the back. So if you have excess fat in that area, you can contour it by liposuction. If you have excess skin, you have to remove that skin, otherwise the wrinkled skin and the loose skin will always be there. So that's how I make my decisions.
Okay, Amy A would like to know, how long have you been doing plus-size surgeries, and why do you work with plus-size patients?
Well, so I started practice in 2008, so now we're coming up on 15 years of being in practice. And right in the beginning of my practice, I published a textbook called Atlas of Abdominoplasty. I published that with Joe Hunstead, who has now retired. And so we did a lot of challenging cases and represented a lot of challenging cases in that textbook. And so that got me started with really doing challenging cases, revisions, complicated patients, and including higher BMI patients. And over the last 15 years, I've just refined that process, doing more and more challenging cases, higher and higher BMI and weight components. And we're always doing so with the idea of doing them safely and getting great results. So that's how we ended up here, doing very challenging cases, very high BMI, very high weight patients, and still doing them safely and getting a great result.
Okay, AJ Drums would like to know, if you pull the lower abdomen skin down and pull the pubic area up, will the hair grow in a new spot?
Well, when you're pulling the pubic area up, you should excise part of the pubic area, because part of weight gain and part of weight loss and part of pregnancy stretches out the pubic area as well. So the pubic area might be initially 2 or 3 inches of height, but then with the weight gain, with the pregnancies, with the weight loss, it extends. So you want to reduce the pubic area to how it used to be and then lift that part up.
Okay, Lisa V would like to know, what is the biggest BMI you can do?
Well, I haven't yet run into a BMI restriction or a weight restriction. Off the top of my head, I think we've done 54, maybe 58 BMI, and turned out great. The patient's super happy. They were out of state. So far, we've pushed the boundaries in the 50s, mid and upper 50s. I look at mainly at health, and I look at the health of the patient and the body characteristics, and I answer 2 questions. Can I do this safely, and can I do this effectively?
Okay. Erica would like to know, during the consultation, will you recommend certain procedures for me? I do not know what would benefit me best.
I can certainly do so. I try to not push surgery on people. I just try to discuss contours and things that might be beneficial. However, if somebody doesn't quite know where to start or how to do it, and they just want me to quote unquote freestyle discuss what I would do if that was my body or if that was a photograph or things of that nature. I'm happy to do so.
Right. Glamorous Lady would like to know, is it possible to get a tummy tuck procedure without being put to sleep?
Technically, yes, you can do it all under local anesthesia. I don't recommend it. Now, there's different kinds of tummy tuck procedures. So someone that is very small, doesn't need a lot of liposuction, you can do a tummy tuck procedure under local anesthesia with sedation. Now, the interesting thing about sedation is there's a kind of a gray zone where at some point you have sedation and at some point it becomes general anesthesia and you're technically quote unquote put to sleep. So the short answer is yes. The long answer is you probably shouldn't do that.
Okay, Roberta would like to know, how long after a surgery do I need to wear my compressions for and why?
I recommend at least 6 to 8 weeks, and that varies a little bit from individual to individual. But the reason for why is the body really responds with inflammation and swelling. And we want to moderate that. We want to help the body out so that it doesn't have to work so hard. The other component is we want to compress the tissues that we've dissected and worked on so that they're nice and tight, so that in between all those little spaces that we've done liposuction, it doesn't form with fluid, because that can add a little scar tissue. So we want things compressed so that at the end we just have skin and fat. We don't have skin, fat, and scar tissue.
Vaughn would like to know, do you perform your surgeries in a hospital or a surgery center?
I perform them in a surgery center. It's an outpatient surgery center. It's fully licensed by the state of Arizona. We are across the street from a hospital, however, and I have privileges at the hospital. We've never had to transfer patients emergently to the hospital, but it is there if ever we need it.
Right. Jill would like to know, what do you think about during long surgeries, and do you get a break?
Oh, that's a good question. My mind seemingly always wonders a little bit, but you never know what another person's mind goes through, so you don't know if it wonders more or less. But obviously, in the beginning of the surgery, I don't think about much. I think about what I need to do. And then as we go into the more routine parts, where basically now we're doing the more technical parts, suturing and things of that nature, where the decision-making process has been eliminated and you're just doing the mechanical, technical part. I think about a bunch of random things, actually. Sometimes I catch myself thinking about a lot of random things, and I actually ask myself, why am I thinking about those random things?
Right. Future RN would like to know, do you work with patients with sickle cell trait, not disease?
It shouldn't be a problem. We evaluate each patient based on what they need, and if we're not quite sure about their health status based on their condition, we can work with your consultant. Sometimes people have doctors specialists that they see for that, and then we can touch base with them and ask them what they think if they see any issues with proceeding with surgery. But it should not be a problem.
Right. Rihanna would like to know, is there a time limit to surgeries that can be performed during one procedure?
Well, we've operated for 12 hours straight on a single patient, and they did great. However, right around 9, 10, 11 hours, I start getting a little tired. Now, obviously, we have staff in the room, nurses and scrub techs and an anesthesiologist, and I'm sure they get tired as well. But I'm just speaking for myself that I tend to hit a little bit of a wall in that 10, 11 hour time frame. So I try not to go beyond that because I owe it to the patient to give them 100%.
And Callie G would like for you to break down the recovery timeline for a plus-size tummy tuck.
Well, we usually recommend for the first 2 weeks to stay here in Arizona, so you and I can see each other a handful of times. The second 2 weeks, if you're local or if you're from out of state or from out of the country, I would recommend doing more of the same, meaning just focusing 100% on your recovery for that second 2 week period. However, we understand that some people can't do that. They have responsibilities that they can't change: family, kids, work, other responsibilities. And for those people, we say do only the things that you absolutely have to, but avoid all the things that you can avoid, because your body really needs as much time and energy to recover. And then we say no working out for 6 to 8 weeks.
Right. Ariana would like to know, what is the most amount of fat someone could get lipoed off?
It depends on your height. It also depends on potential other issues, or whether you have heart or lung issues, or whether you have like iron deficiency anemia. and your ability to restore blood volume. 5 liters shouldn't be a problem for pretty much everyone. You can very safely go into the 7, 9, 10 liters for most people. And then the taller people, you can go even beyond that. As long as you do it properly and do it the proper aftercare, you can do that pretty safely.
Okay, Naomi would like to know, can a tummy tuck, arm lift, and thigh lift be done together? And would you recommend doing it all at once?
They can be done. We have done. Whether we recommend doing them all at once depends on your body, and primarily with the thighs and the tummy tuck, because most people, including myself, like a tummy tuck incision to be super low in the bikini area. And then conversely, if you're getting a thigh lift incision, you'd want that to be super high in the close to the growing bikini area. So as you can imagine, for that specific patient, those two incisions can be very close to each other and pulling in opposite directions, not ideal. So for those patients, we may want to stage it, tummy tuck on one, thigh lift on the other. However, there's a lot of different types of tummy tuck incisions. There's a lot of different types of thigh lift incisions. So we can go discuss that case by case.
Right. Ellen C. would like to know, I live in Canada. Do you accept out-of-country patients?
Yeah, I think 35 or 40% of our patients are out of state or out of the country. We get quite a few from Canada, and then we also get a few from Europe, England, and things of that nature. So every year we do at least maybe half a dozen to a dozen patients from Canada. So we have gone through that process before.
Right. Darlene J. would like to know, what is included in a mommy makeover?
Well, a mommy makeover could be a lot of different things, so you get to define what a mommy makeover is. Usually a mommy makeover is something with the tummy and something with the breasts. So like a tummy tuck and a breast lift, or a tummy tuck breast augmentation and breast lift. But it can be anything you like. It can be a tummy tuck and then buttock fat transfer. It could just be a tummy tuck. It could just be a buttock fat transfer, for example. It doesn't have to be anything specific.
Erica would like to know, what tests are required prior to your surgery?
It varies from individual to individual. If you're healthy and below a certain age, there's really nothing that's required. If you have some medical problems, there will be some medical clearance requirements from your primary care doctor. If you're a certain age, we'll start getting lab work and EKG. Then if you have certain problems, maybe you're a little bit pre-diabetic or diabetic or something like that, we'll want to get lab work and things of that nature. So it varies from individual to individual, and we'll walk you through the abdomen. You can imagine if the upper half of your abdomen is perfect and you have loose skin by your pubic area, you will not want to pull up because it's pulling from a very far distance. You'll want to do a horizontal incision in your pubic area, in your bikini area.
Perfect, thank you. How much does your BMI affect the surgery length and the pricing?
It can, yeah. So the BMI can affect the surgery length because obviously there's going to be more liposuction involved, longer incision, more dissection, more suturing. So yes, the higher the BMI tends to be, usually the longer we need in the operating room. And all of our quotes are based on the length of time in the operating room.
Alex would like to know, what is your professional feedback on traveling by plane for a surgery?
Obviously, all of our patients are from out of state and out of the country, other than maybe the patients that live in, let's say California, Colorado, and New Mexico. Everyone further than that tends to fly. So it's not a problem. Regardless of whether you drive or fly, it'll be important for you to continue to do all the things that we've communicated in terms of the recovery protocol. Regardless of whether you're flying, driving, or even whether you're local, you should always be doing the things that we told you for the length of time that we told you to do them. And that's for your own health, to prevent problems, but also to make sure we don't slow down the recovery process.
Silva would like to know, what payment plans do you work with, and do you take insurance?
We have stopped taking insurance maybe about 2 years ago. The payment plans that we accept is we work with 3 third-party companies, Care Credit, Alphion, and Patient Fi. And they provide you with a loan for the procedures that you're having, and then you make payments to them. There are other companies out there as well, but those are the 3 that we primarily work with.
Kaylin would like to know, what are some health restrictions that do prevent people from getting a surgery done?
Well, the most important ones is heart and lungs. So if your heart is not in good shape, where it may not be able to sustain anesthesia, then we don't want to do surgery. If your lungs are not in good shape, where maybe you're not going to be able to oxygenate properly, then we want to do surgery. Other things might be things like very low blood count. That means you have anemia, and if it's not corrected, we don't want to do that. If your parameters are otherwise not controlled, very high blood pressure, very high glucose for diabetes, those are all things that will make it unwise for us to do surgery because of safety reasons.
Right. Caitlin would like to know, what does muscle repair do? Can you create abs with it?
Well, muscle repair brings the rectus abdominis muscles, which are vertical muscles in the center, back to where they used to be. So when we're born, unless we have a problem with how we're developed, those muscles are close together in the center. Through weight gain, weight loss, and pregnancy, they get pushed out, and they don't tend to come back in. So muscle repair brings them back in with sutures. When you see the striations of people that have like a six-pack, what you're seeing is the natural ligaments and indentations within the rectus abdominis muscles with a very thin layer of fat over it. So the liposuction will help with that because it thins out the fat above the muscle. And then of course you can bulk up that muscle on your own.
All right, Shireen would like to know, what is your favorite procedure to perform?
I like doing a lot of different things. The more impact I can make in the patient, but also in the difference between the before and the after, the more I tend to like it. So that could be rhinoplasty, that could be facelift, that can be a tummy tuck. I do enjoy a challenge, and I do enjoy kind of geek out on doing things that there doesn't seem to be a solution for, where it hasn't really been published, it hasn't been discussed, and so I have to kind of figure it out on my own.
All right, Brittany would like to know, how do you avoid capsular contractures?
So capsular contracture is a thickening or a hardening of the normal tissue that forms around any prosthetic device, including a breast implant. And so it's not a completely understood phenomenon, but it tends to have some connection with the prevalence of small amounts of bacteria that just live in there. And that results in an ongoing process of inflammation that just kind of keeps circling itself, and it forms a thicker and thicker scar tissue. So one of the most important things for preventing or reducing the chance of capsular contracture is to really do proper tissue management, not to have bleeding, not to traumatize the tissue inside, and then of course to really use clean technique for putting the implant in there so it doesn't get contaminated with skin cells.
Okay, Leslie would like to know, do we need to have a diagnosis for a hernia prior to seeing you, or can you diagnose us with one?
We can diagnose you.
Marianne would like to know, how long does a BBL take to heal?
Well, it heals in a kind of a linear fashion where every day is a little bit more healing. I would say that by about 2 months, the swelling is for the most part gone. The amount of fat that has absorbed and also has established itself is pretty much there. So I would say about 2 months.
Okay, Terry would like to know, if you have a broken leg, can you get a tummy tuck procedure, or would you recommend waiting until it's healed?
Well, that's a very good question. I don't think I haven't gotten that question before. I guess it all depends on where the break is and how it's impacting you. If you have a broken leg where your leg is in a cast, it's going to reduce your mobility a little bit, and it potentially increases the chance of a blood clot. If you have a broken leg and they put a titanium plate in there and now you're walking on it, and you're walking on it fairly normally, then it shouldn't make that much of a difference.
Tanaya would like to know, do the breast-lift scars stay there forever, or will they gradually fade over time?
Well, technically all scars stay there forever. However, if we do a good job and that the genetics of the person doesn't prohibit us, the scars should continue to fade with time, and eventually they should be pretty close to the color of the skin of the individual.
Okay, she also would like to know, how many types of breast lift incisions are there, and how do you determine which one they need?
Yeah, there's a lot. Which one is needed depends on what the breast tells us shape-wise, and then what the shape we're trying to accomplish. There's three general ones: an incision around the areola, an incision around the areola and then down the breast, an incision around the areola down the breast, and either an extension of that, either most likely the outside, and some people also like a big smiley face here underneath the breast. I tend not to do that one.
Okay, Narla would like to know, does the breast lift drop over time?
It does, because the breast is basically skin, some fat, a little bit of gland in there. So it's not like a bone or a tight tendon or something like that. And so we repair those things to hold it up, but gravity is always pulling it down. If you have a very big breast, then of course it's not going to stay 100% there. It's going to come down maybe 10, 20%. If your breast is smaller, then maybe only 5 or 10% droops down. It's not going to go down to how it used to be, so it'll still be basically the same, but it won't be exactly the same as it was maybe in the first 3 to 6 months.
Right. Allison would like to know, do you recommend getting a tummy tuck before or after having a baby?
Well, that's a good question. So the answer is you can do both depending on who you are. So for example, let's say you're 20 years old and you lost 100 pounds because you used to be very big and now you lost all that weight. So you have all this loose skin. And you're not planning on getting married anytime soon, and you're not really planning on having kids for at least maybe 10, 15 years. It doesn't make any sense to wait until you have kids. You might as well just have a tummy tuck, feel good in your body, get the benefits of that, have the babies, and then you can always revise the tummy tuck later on. On the other end of the spectrum is if you're planning on getting pregnant next year or something along those lines, might as well just wait and have the tummy tuck done afterwards.
Pamela would like to know, what can I expect pain-wise with the tummy tuck?
It varies. We do a lot of different things in the operating room. Dr. Linker, anesthesiologist, works his magic with anesthesia. I do certain different things in the operating room with both long-term anesthetics and how I manage the tissues. The first week is the week where you're probably going to take some pain pills. Most of our patients, 2, 3, 4 days into it, they usually stop taking pain medication. Some of them go a little bit longer, and then some of them actually don't take any at all. But on average, the first 3, 4, 5 days, you're probably going to take some pain pills, the narcotics, and then you're probably just going to take a regular over-the-counter ibuprofen and Tylenol.
All right. And then final questions, how can someone go about setting up a consultation with you?
Well, we have a lot of different ways. You can message us through Instagram, you can message us through TikTok, you can message us through all the different social media apps that we're on. But you can also go on drrepta.com and you can click that consultation button up top. You can also call us at 855-377-3782. And then we'll set up a virtual consult first, so regardless of where you are in this world, we can do a quick consult. And that'll be able to give you, based on that, prices, like a quote, and then you can know whether it's something that you want to do and what is appropriate for you, and then approximately how much it will cost.
Right, and then following that consult, how far booked out are you for surgeries?
It varies depending on how long the case will be. I think we have maybe 1 or 2 spots in November, 1 or 2 spots in December left. And then we're booking out into the January, February timeframe.
All right, well, thank you so much, Dr. Repta.
Thanks, guys. It was fun.